What's going on, everyone? It's your favorite prior authorization, and yeah, today I have my glasses off. You know that means it's serious. And yeah, I wanted to just rant about the U.S. healthcare system. Now before I say anything, right, what I'm about to say is about the system. It's not necessarily about the people just engaged in their jobs doing stuff. Like, that's not who I'm talking about when I say all this stuff. I just literally mean the way things are set up in the US as regards healthcare. And most people worldwide know how effed up it is, basically. Like, um, and I do feel like I'm qualified to speak on this, and I do want to say in advance also that I don't want people to take me as ungrateful, but the system definitely has its issues, guys. It has its glaring issues, and I'm just one person who's lucky enough to be receiving expanded Medicaid services because I have a severe disability, which is cerebral palsy, but as I love to say like a gazillion times um on this channel, I went and I got an education. You know, I have 3 degrees technically. Um so it's not like I'm a mooch or something. You know. But anyway, yeah, I mean, what can I say, guys? The US healthcare system is needlessly um complex on the state and on the federal level. I know that um Obamacare was definitely a step in the right direction, and you know I recently also went to my state legislature and I sat in on a hearing about cuts to healthcare and disability services, which they're like, I know it's not necessarily the state's fault because of, the big, beautiful bill, which is what is causing the shortfall in the first place. I'm not blind to that, but my state, um, specifically, the first thing that they want to do, obviously, is cut disability services, cut the care hours that, are used to take care of people like me. Um, and, you know, as you guys also know, I'm one of those people that genuinely believes in civic virtue. I have a classical education, and I feel like the decline of civic participation, of civic virtue all throughout the world, not just in the US, is sad. It's one of the things which, a lot of people talk about, quote, the West, but it's like, bro, the Greeks were based in that respect. Come on now. Like, for them, like, virtue couldn't exist without civic participation. And so, but at the same time, bro, I literally went to a hearing and um essentially watched government officials lie to the faces of everyone that was there. And that day that I went, there were like so many families and advocates of all types that just like they were fed up with the fact that they were about to cut these services which we need for our care, which allows our families to be involved and allows us to do activities like Um, I finally understood why people don't vote. To be honest, it was that eye opening. I'm like, oh my gosh, because they were saying, oh yeah, like the caretakers we contract are, yeah, they're eligible for benefits and stuff like that through the agencies or like part of the budget. We like set apart so that they can get health insurance and like a lot of them are paid good wages. Now where I live it's pretty expensive, right? You have to It's not the most expensive place ever or anything like that, but most people either you have to be working multiple jobs or have lots of roommates or stuff like that if you even want to consider it, even with uh degree and stuff like that, even with a quote unquote good paying or like, even though I dislike the term non-useless degree, um without, and that's without debt, trust me, I know, because I well, okay, I have a liberal arts degree that is kind of useless, not gonna lie, but you get what I'm saying, bro. Back years ago, it didn't matter what type of degree you got. You could still on one source of income get that stuff, but like, they were just saying all these lies that they paid them well when, I mean, like, that's just not the case, bro. It's just not the case. They aren't paying them well. They aren't giving them options for health insurance and stuff like that. Um, they keep cutting hours. Even for stuff that is necessary. Like for example, what they do is they approve a plan and they send it through a coordinator and stuff like that, and that's part of the problem, guys. Like, they have so many different middlemen and each one of them gets their cut, and by the time it reaches the actual client, aka your boy, um like, there's so little money left for them to actually do what they need to do. But like, for example, like, in the actual, they call them plans of service, which you hand into the state and they approve a certain number of hours, which they then allow an agency to contract to pay the CNA or nurse that takes care of you. In my case, and in a lot of other cases, especially now with the labor shortage, it's like my family, like my mom or my brothers, whoever, right? And like, the thing is, guys, I work out like 2.5 hours probably every day. I do a full body workout every single day to keep in shape. You know, when I was younger, I would work out to build muscle, but like, that's not really my focus anymore as I get into my 30s. Um, because I'm in my like later mid 20s. I'm 27. Uh, and in 6 months I'll be 28. So like, but the state doesn't consider exercise a good enough reason to increase hours. Bro, what does that say that they think about us? They think we're useless, bro, that we now, I'll give them this: a lot of physically disabled people especially don't do exercise or can't do exercise. That's completely fine. I'm not judging anyone, but what that is implicitly saying is that you shouldn't exercise because your care hours are not going to include it. So therefore, you know what, just don't do it, bro. We talk about like, oh, like, yeah, helping people, um or that the welfare state should essentially get people to, like, be themselves independent, and like there's all sorts of counterintuitive policies like that. Now, to be honest, and I know my more conservative viewers might not like hearing it, but the most efficient option is to just have a public option and get rid of the middlemen, and just, excuse me, have it all be done, directly by the state. Get a public option which includes waivers for these types of things. Instead of having, bro, because like I have a coordinator for my actual insurance, which, because I live in a state with Medicaid expansion, is actually like point of service, kind of. We'll get into that later. Um, Insurance, right? I can just show them my card, and it's like, you know, they render whatever service it is, usually. Um, so I have a coordinator for that. I have a state coordinator who's a nurse who comes in and checks in on me. I have uh or a nurse practitioner, and then I have another social worker for the the caregiver themselves, and then I have one of the nurses from the agency. And like, bro, like, to be honest, I get confused which one is which. And at least in my state, there's like maybe two or three social work agencies that handle this type of thing. And the kicker is that the one that got assigned to me is a company which is a big conglomerate. And I have two different coordinators from the same company, but because they're subsidiaries, they can't share information. What? I'm sorry, but please blow up the private sector. No, I'm just joking, but like, what is that, guys? What the what? Um. So yeah, you end up again with all these middlemen's the solution. I think even the Cato Institute about 5 to 10 years ago, don't quote me on that, said that like, yeah, like, if we introduce the public option, like, it would save us like trillions of dollars over 10 years or something. Like, don't quote me on that. But like, point is, I have so many coordinators with overlapping duties, and like with various different restrictions and freedoms and jobs, that it's just like, bro, it doesn't have to be this complicated. We've tricked ourselves into thinking that more jobs is automatically good. It doesn't matter if those jobs are actually needed, or if they're actually redundant, bro. And like, before you say, "Oh, well, how is the government going to make that any better?" Bro, every single developed nation, even some middle income countries, have a form of universal health care. Now, some do that alongside the private sector, like in my native Guatemala, for example. Like, am I saying that it's good? No, of course not. But at least people don't have to go into crazy amounts of debt just for something they couldn't help, which is their health, guys. Like, I know I'm not saying anything revolutionary, but I think people it would help people to hear it from not the horse's mouth, but the cripple's mouth, dog. Come on now. And I'll give you guys another example. So in the US, we have this system where it's like a private marketplace that you go through your usually state government, right? The MCOs, the managed care organizations, which then they match you with a private insurance policy, uh, based around your needs, your family, whatever, right? Well, here's the thing. Because my state has Medicaid expansion and I applied, um, and I have a qualifying condition, right? Cerebral palsy, I have all three types. Just cerebral palsy generally affects around 2 in 1,000 people in the United States. I mean, I was born in Guatemala, but those are the stats for the United States. It's actually, I think, the most common physical disability in the country, but even then, it's still pretty rare. Anyway, I qualified, so I don't have an MCO, guys. Like I said, it's as close as to what you will get to a point of service, like just handing them your card and, like, getting service for almost whatever I need. I'm grateful for that. But even then, guys, even then, uh, I'm gonna give you guys an example. I wanted to get a flu vaccine this year, right? Um, but the problem is that once again, private business getting in the way of people getting their care. This is just a simple example. That's why I mentioned private authorization in the beginning. No one or prior authorization in the beginning. No one likes that. It was ironic, but you get me. Like, guys, I wanted to get a vaccine, okay? But the way it happens is that these MCOs, these private insurance companies, each individually partner with pharmacies to distribute vaccines and have them cover it. Like, they're specifically branded, usually pharmacies that they partner with. Um, and you're like, okay, why is that a problem? Can't you just get anyone? Well, the problem is, guys, is that I don't have a managed care organization. I'm not affiliated with any private company. My healthcare coverage comes directly from the state where I live in. So I literally, and before, my doctor's office that I used to go to up until this year would do vaccines themselves. So it wasn't ever a problem. I could just go to them and they would administer the vaccine and it would be covered under a general doctor's visit. Well, they moved to a different area far away from me. And the place close to me that I had no choice but to go to. It's literally the closest one within where I live. It's walking distance to me. So it's not like I had a choice, right? Because can I drive? Can I have like my mom drive me? Of course I can, guys. But it's like you don't know how complicated it is to load a handicap van up, to get ready, and then to go like 20, 30 minutes. And that's another thing, although we're not talking about that today, but that's because the US is car centric to an absurd degree, right? That's that's gonna be my next like thing that I'm gonna nah. I don't know if it's gonna be my next one, but yeah, anyway, they don't do vaccines. That new doctor's office that I've been at for around 8 months now, they don't do vaccines for adults. They do them for minors. I'm not a minor anymore though. I haven't been for almost a decade. Um so yeah, guys, I just didn't end up getting the flu vaccine, and wouldn't you know it, this year I got sick with the flu twice. Twice, guys. Yeah. Oh, the other um years where I did get the vaccine, it happened maybe once at the beginning of like October, end of September, but not anymore. This year it happened to me twice. What is that, guys? Come on now. And having that Medicaid expanded state insurance is supposed to be great, but it's like they clearly didn't think this through um with Obamacare. And it's like, oh, well, why don't you go to your local health department? I tried that, bro. I can't get them to answer the freaking phone and put me in touch with an actual human. I tried that 3 times in the last few months, guys, and I've never been able to get in contact with someone that wasn't a machine. Um, So yeah, guys, what can I say other than Medicare for all? I mean, I understand prior authorizations for stuff like wheelchairs and whatnot, but I even have had to used to get prior authorization for freaking physical therapy. And like, the thing is, the what's funny is that the provider that the state actually did choose um was reported, believe it or not, recently, because they were asking for prior authorization for things within my program, which again is supposedly, you know, um, at the point of service insurance, for things they shouldn't have been, including my physical therapy. Um, and as soon as they got rid of them as a provider, and see how complicated the system is, because it is private yet it's not private yet it is private in some instances. Like, bro, just make it public. Just make it public and tax the billionaires to pay for that shit, bro. That, um but of course, because neoliberalism is our current economic model, that's never gonna happen. Well, I mean, I hope it will. Especially as I get more into advocacy. But uh, yeah, guys, what can I say? Medicare for all. Come on, we de- the people need that, bro. We need that desperately. Um, but now, thankfully, I get physical therapy almost every week, and or every week, once a week, for an hour. And like, I don't need any prior authorization, because, and I always thought that was like super weird, and because they would only authorize it for a certain number of days, and each time I would have to go back to my neurologist and like get more authorization. I'm like, bro, I'm permanently a cripple. I'm not gonna magically get cured of cerebral palsy. Like, anyway, guys, it gets me some type of way, and like, yeah, what can I say other than Medicare for all, free Luigi, and yeah, um, I hope that socialism takes further root in American society. All right, bye.